99% of failed VBACs are not due to uterine rupture, and I'm going to tell you why. My name is Sophie, and I am a holistic birth keeper in Central Kentucky. I love studying about variations of normal in birth and not necessarily what the medical society considers the cookie cutter, low risk, normal vaginal birth. I wanted to make a video to talk about VBACs and why they're not super common in America. Why would somebody schedule an elective repeat cesarean? Convenience. Convenience means they know when their birthday, the baby's birthday, is going to be. They're not going to be waiting around wondering when labor is going to happen. They're not going to wonder what the sensation of labor and contractions are going to feel like. Fear of uterine rupture. It's something I'm going to talk about shortly, but fear of uterine rupture is super common in women in America who've had prior cesareans. The unknowing of vaginal birth and the certainty of cesarean. So if you've already experienced a cesarean, there's not a whole lot of wondering what's going to happen. There definitely are still variables. Your risks for other things are a lot higher with each subsequent cesarean, but you don't have to deal with the unknowing of what a vaginal birth entails or how your provider is going to act in a vaginal birth, especially if you are using the same provider that you had your last cesarean with. Some women aren't aware that VBACs are an option at all. They get pregnant with their next child and they go back to the same OBGYN. So why would a provider suggest a repeat cesarean? Some of the reasons that a provider would suggest that you go ahead and schedule your elective repeat cesarean for your current pregnancy is if you had failure to progress in your last labor. A diagnosis of big baby, whether that was your last baby or your current baby, diagnosis of big baby is a huge reason that providers push to have another cesarean because the woman does not have a proven pelvis. By proven pelvis, that means that a baby has not exited through your pelvis. And all women are not the same, but all women are created to birth their babies. It is 1 in a million almost that women truly do not have the pelvis structure, the pelvis opening size to successfully vaginally birth her baby. No dilation by 39 weeks. And it's pretty sad because plenty of women healthily go over their due dates. They go 2, 3, sometimes 4 weeks past their due dates, and then they birth healthy babies. If your provider is telling you that you aren't dilated at 39 weeks, biggest way to avoid that is to not get a cervical exam. What they don't know, they can't use to scare you. And that probably sounds harsh, but if you deny cervical exams, A, it's within your right, and B, it doesn't put anything in your head either. So even if your provider just tells you that you're not effaced, you're not dilated at your 39-week appointment, you might start thinking that maybe my body isn't adequate to birth my baby. Maybe this isn't going to happen for me. And that starts to put fear and doubt in your mind, which does not need to be present whenever you're about to welcome your baby into the world. There's no waiting for labor. There's no waiting for labor. So that goes back to the certainty and not having to face the unknowing that is vaginal birth and awaiting spontaneous labor. The last thing that a provider unspokenly may use to suggest an elective repeat cesarean is money. OBGYNs are trained surgeons, and the hospitals make over 3 times as much off of your cesarean than they were to if you were to have an unmedicated vaginal birth. What are the pros of having a VBAC? There are so many. You're avoiding major abdominal surgery. Any major surgery comes with risks of an infection rate. So you're avoiding all of that. If you decline any type of cervical exams in general in labor, you are plummeting your infection rate by being in the hospital. If you decline cervical exams in your home from your midwife, you are plummeting your infection rate that is still even present, way smaller than a hospital birth, but it's still present in a home whenever you're accepting cervical exams. Lower rate of maternal death, quicker recovery, shorter to no hospital stay. You have a VBAC at home, 0 hospital stay. If you have a VBAC in the hospital or a birth center, technically you can check out without causing a bit of disruption within the medical staff about 24, 25 hours after birth. Some hospitals are like not even batting an eye if you check out before then, and some are trying to make a huge stink over it. Baby receives the perfect start to good gut health by receiving all of the amazing and great bacteria that is in your vaginal canal. You're decreasing your chances of blood transfusion and hysterectomy. Breastfeeding can be established quicker and easier. So whenever you have a cesarean, if you've had one, you know that as soon as baby is born, it doesn't go exactly how you're envisioning it to go. As you see in birth videos or in hospitals, movie births. And it's sad because it's something that not really anybody prepares you for most of the time. Whenever you have a vaginal birth or a VBAC, baby is immediately coming to you in a good situation where you're advocating for yourself or you have somebody that's advocating for you, which means that you're exchanging pheromones. Babies, where they're familiar, they know you. You are all they know, and they know your smell, they know your voice, they know the temperature of your body, and that is what instigates successful breastfeeding within a few hours after birth, as opposed to a cesarean where it could be a few hours after birth until you even see your baby for the first time. Cons for a VBAC. There's pretty low risks for most all of these, but they are still present risks that should be talked about and prepared for. Potential pelvic floor damage. This usually occurs in coached pushing or prolonged pushing in a not optimal position, like on your back. Unknowing of baby will come. Baby will come, you just don't know when. Uterine rupture, which is less than 1% usually, so not a whole lot of cons. What are the pros for an elective repeat cesarean? You have a 0% chance of uterine rupture. You go in, you have your surgery, you meet your baby, you're not laboring at all. Convenience, control, and none of the unknowing. The cons of an elective repeat cesarean are pretty long. They're probably much longer than the list that I have for this video and much more in-depth than what I'm going to share with you, but I'm going to run through them in a bullet point. At least 2 times the blood loss in a cesarean versus a vaginal birth. 4% of women will hemorrhage in a repeat cesarean as opposed to a VBAC. Adhesions of pelvic floor or abdominal muscles that can lead to pain, infertility, painful intercourse. There is a 3 times higher rate for maternal death for repeat cesareans. You're 4 times more likely to develop blood clots. After 4 prior cesareans, 1% of women will experience placenta accreta, which is not diagnosable via ultrasound, and you will not know you have it until labor begins, or until they begin your repeat cesarean. Cesarean babies are 4 times more likely to have breathing problems upon birth. There is a 0.5 to 1% chance of bowel and bladder injury in a cesarean. Then you have all the general risks of major surgery. Allergic reactions to anesthesia, severe pain, blood clots, kidney issues, collapsed lung, and death. Okay, we're gonna wrap it up by talking about your general statistics. So your overall risk of uterine rupture. With 1 prior cesarean, that stat is 0.51%. With 2 prior cesareans, that stat is 1.85%. As well as 3, 4, and 5 prior cesareans, your risk of uterine rupture is 1.85%. Your overall risk of placenta previa, which can be ruled out via ultrasound. With 1 prior cesarean, your risk is 0.65%. With 2 prior cesareans, your risk is 1.8%. With 3 prior cesareans, your risk is 3%. With 4 and 5 prior cesareans, your risk is 10%. Your overall risk of placenta accreta, which is not diagnosable via ultrasound. 1 prior cesarean, you're looking at 0.31% risk. With 2 prior cesareans, you're looking at 0.57%. With 3 prior cesareans, your risk is 2.13%. With 4 prior cesareans, your risk is 2.33%. Your risk with 5 prior cesareans is 6.74%. Your risk of scar separation actually lowers with each subsequent VBAC after a cesarean. With no prior VBACs, your scar separation statistic is 0.87%. With 1 prior cesarean, your risk is 0.45%. With 2 VBACs under your belt, your risk for scar separation is 0.38%. So you want to have a VBAC. Do you have a supportive or unsupportive VBAC provider? A non-supportive provider would require you to go into spontaneous labor by 39 to 40 weeks. A supportive VBAC provider would have no time limits on how long you can be pregnant before you go into labor. A non-supportive VBAC provider would talk about your odds and the statistics based on the VBAC or TOLAC calculator. A supportive VBAC provider would really relish in all of your birth wishes and really help you establish good ones and ones that are set in stone and help you feel confident in those. A non-supportive provider would suggest that you have a big baby or a small pelvis diagnosed via ultrasound. A supportive provider would discuss how there are huge margins for error in taking any types of measurements through ultrasounds. An unsupportive provider would require or heavily suggest that you get an epidural placed just in case. A supportive provider would talk about the importance of being upright, having freedom of movement, and really taking advantage of that as much as possible all the way into active labor until you feel as if you don't want to anymore. To cap this video all the way up, I did want to say that choosing to have an elective repeat cesarean is okay. It is completely okay as long as it's your informed choice. To give informed choice, you want no evidence-based information and stats on all of your options. To not be bullied, coerced, or misinformed by your provider, your family, or your peers. And make a confident decision, not a fear-based one. Fear-based decisions in birth planning almost always come out in birth and postpartum, and we tend to overthink them. We tend to regret them or shame ourselves or kind of isolate, and that's not something that you want to deal with postpartum. And most women that go into their first pregnancy know exactly what I'm talking about. If you have your little kid running around, you know choices that you made that you would have probably done different had you known all of your options. If you want to know more about VBACs or your statistics or just information in general from other people, other sources all around the world, you can check the description. I have links for a couple of different places, one of them being ican.org. And to learn more about birth work in general, VBACs and other variations of normal, you can take the same course that I did through the same organization that I love, and that is HERBAL, and I'll put a link for that in the description too.